Hello friends, welcome to our YouTube channel Target Nursing. So friends, in today's video, we are going to see some important questions for AIIMS Nursing Officer exams. In this, we are including some MCQs, multiple choice questions. So I'm going to tell you today that which questions are important, and these questions including all the subjects like OBG, pediatric, med surg. Okay, and these are the merge of all the questions from all the subject. So today we are going to see about the important questions for the AIIMS Nursing Officer exam. So let's start it. Okay, so first question is here that normal adult hemoglobin contains. Okay, so first question is here that normal adult hemoglobin contains. It's not asking the value of hemoglobin. The question is about contain. What hemoglobin contain? Okay, so there are four options. A is 2 alpha chain and 1 beta chain, and B is 1 alpha chain and 2 beta chain, and C is 1 beta or 2 alpha, or D is 2 alpha and 2 beta. Okay, so the right answer is here is 2 alpha chain and 2 beta chain. Okay, I'm going to tell you further that how it's possible. Okay, it can be possible that 2 alpha and 2 beta chain is normal adult hemoglobin contain. ठीक है, hemoglobin में हमारे 2 alpha and 2 beta chains होते हैं normal adult के. ठीक है, then the next question is fetal HB is. ठीक है, अब इसमें भी क्या पूछा है, fetal HB, fetal hemoglobin contains. ठीक है, मीन्स यहाँ पे कोई ऑप्शंस हमारी वैल्यूज नहीं दी हुई है, यहाँ पे कोई ऑप्शंस जो है, here the options are in alpha and beta. Okay, so here's the first option: A 2 alpha and 2 beta, B 2 alpha and 2 gamma, and C 2 alpha 2 delta, and D 2 alpha 1 gamma. So okay, so here's the right answer is 2 alpha and 2 beta also. ठीक है, because ह्यूमन बीइंग में क्या होता है कि 2 alpha and 2 beta चेन ही होती है हीमोग्लोबिन में. Okay, so the right answer is 2 alpha and 2 beta. So we are going to see the explanation of these questions. So here the structure and function of hemoglobin. Okay, तो hemoglobin is found exclusively in RBCs. ठीक है, hemoglobin जो है हमारे वो RBCs में found होते हैं. Main function is to transport oxygen from lungs to tissues and carbon dioxide and hydrogen protons from tissue to lung. The main function of hemoglobin is transfer. What does the hemoglobin do? The hemoglobin helps to transport the oxygen from lungs to tissue. ठीक है, oxygen from lungs to tissue and carbon dioxide and hydrogen protons from tissue to lungs. Okay, for the exhalation process, means the inhalation and exhalation process. For inhalation, what it will do, it transport oxygen from lungs to tissues, and in exhalation, how it can be help in the exhalation process, that carbon dioxide and hydrogen proton it will take or it will transfer from tissue to lungs, so that we can exhale the carbon dioxide and inhale O2. Okay, and the hemoglobin A is a major hemoglobin in adult. ठीक है, there are types of hemoglobin. ठीक है, first one is hemoglobin A and HbF, HbA2 and HbA1c. ठीक है, so there are four types of adult hemoglobin, but the major one is HbA. ठीक है, HbA hemoglobin is major hemoglobin in adults. It composed of 4 polypeptide chain. ठीक है, 4 polypeptide chain होती है इसकी, and 2 alpha and 2 beta chain. So the question was what? 2 alpha chain and 2 alpha and 2 beta. Okay, so normal adult hemoglobin contain 2 alpha and 2 beta chain. Okay, so these are the 2 alpha and 2 beta is a polypeptide chains and held together by covalent interactions. ठीक है, each day 6 to 7 grams of hemoglobin is synthesized to replace lost through normal turnover RBC. Each subunit has stress of alpha helical structure and heme binding pocket. Okay, so there are four types of hemoglobin: HbA, HbF, HbA2, HbA1c. ठीक है, so HbA जो होता है, it was a major hemoglobin in human being, and HbF is normally synthesized during fetal development, and HbA2 first appears in 12 weeks after birth and a minor component of normal adult hemoglobin, and HbA1c has glucose residues attached to beta globin chains, increased amount in DM. So this is about hemoglobin. So now I hope you have cleared the concept regarding the alpha and beta chain. These are the polypeptide chain, and the hemoglobin is made up of 4 polypeptide chain composed of 4 polypeptide chain, 2 alpha and 2 beta in fetal and in adult also. Okay, and HB is the most common type of hemoglobin. Then moves to the next question. Okay, and here's the fetal hemoglobin. HbF has a greater affinity to O2 than HB. Okay, and low O2 percent by time blood reaches placenta. Fetal hemoglobin must be able to bind with oxygen with greater attraction than maternal hemoglobin. और इसमें भी हमारे क्या होते हैं 2 अल्फा एंड 2 गामा यूनिट्स होते हैं. ठीक है, तो fetal hemoglobin have ability to bind with oxygen means the fetal hemoglobin have greater ability to bind with the oxygen in comparison to maternal hemoglobin. Okay, this is about fetal hemoglobin, and this is about adult hemoglobin, and it's about the structure and function of hemoglobin. Now move to the next question. The third question is the main cardiac output of the fetus. Okay, so here's what happens that the question is asking that the main cardiac output of the fetus का मेन कार्डियक आउटपुट कितना होता है. ठीक है, तो इसका जो राइट आंसर है वो है हमारा 430 ml per kg. ओके, सॉरी 350 ml per kg per minute. Okay, the right answer is 350 ml per kg per minute. These are the main cardiac output. This is the main cardiac output of fetus. Cardiac output कितना होता है fetus का 350 ml per kg per minute. It's the cardiac output of fetus. Okay. And the what is cardiac output? Cardiac output is the amount of blood the heart pumps through the circulatory system in a minute. What is cardiac output? Cardiac output is the amount of blood the heart pumps through the circulatory system in a minute. एक मिनट में जितना हमारा हार्ट जो है वो पंप करता है ब्लड को, एक मिनट में कितना हमारा हार्ट जो है वो ब्लड को पंप कर रहा है थ्रू सर्कुलेटरी सिस्टम, उसे कहते हैं कार्डियक आउटपुट. ठीक है, एंड द फिटस का जो कार्डियक आउटपुट होता है 350 ml per kg per minute. Okay, so here's in this question nothing to understand, it's just you have to know it that the main cardiac output of the fetus is 350 ml per kg per minute. Okay, per kg per minute because it is the amount of blood that is circulated that is pumped by the heart in minute. Okay, and then move to the next question. Next question. Next question is suckling gait is observed in. Okay, so here's 4 options are there. As juvenile arthritis, B as multiple myeloma, and C is PID, it is pelvic inflammatory disease, and D is Parkinsonism disease. Okay, so shuffling gait means it appears as if person is dragging their feet as they walk. Means it was like person may feel like they were dragging their feet as they walk, and step may also be shorter. Okay, और जिनके steps होंगे वो भी shorter होंगे, और उनकी जो movement of arm होगा during walking वो भी हमें कम देखने को मिलेगा. ठीक है, एंड जो उनका shuffling gait मतलब कि पर्सन की जो फीट होंगे वो ड्रैग होते रहेंगे जैसे वो चलेंगे, ठीक है। मीन्स उनका एक स्ट्रेट गेट हमें नहीं, गेट एंड पोस्चर्स हमें नहीं देखने को मिलेगा, हमें शफलिंग गेट देखने को मिलेगा। सो दिस कैन बी अकर ड्यू टू, किसमें होता है ये हमारा, पार्किंसनिज्म डिजीज में, ठीक है। किसमें होता है शफलिंग गेट, हमें किसमें देखने को मिलता है, पार्किंसन डिजीज में, ठीक है। इसमें क्या होता है कि जो पार्किंसन डिजीज है ये डिसऑर्डर है सेंट्रल नर्वस सिस्टम का, ठीक है। इट इज अ डिसऑर्डर ऑफ सेंट्रल नर्वस सिस्टम दैट अफेक्ट्स मूवमेंट एंड मोर ऑफन इंक्लूड ट्रिमर्स, ठीक है। इसमें मेनली क्या होता है कि इसमें ट्रिमर्स आते हैं जिसकी वजह से शफलिंग गेट जो है पर्सन में हमें देखने को मिल सकता है। इट इज अ disease of or disorder of a central nervous system, okay. Now move to the next question. Next question is fifth question. A woman in labor is known as. This question we have seen when we have seen about the labor process. That time I told you about the process of parturition, initiation of process of parturition, and I have told you that that time that the woman in labor is known as parturient, okay. Women in labor is known as parturient, and the process of giving birth is known as parturition, okay. And here the options are gravida, para, pupera and parturient. The woman in labor is known as parturient, okay. Gravida is like how many times the mother has conceived, okay. And the para is that the mother have conceived and the baby has survived after 24 weeks, and pupera is the period after delivery. So the woman in labor is known as parturient. The right answer is parturient, okay. And the sixth question is the other name of body mass index, ठीक है। बॉडी मास इंडेक्स का अदर नेम, ठीक है। तो बॉडी मास इंडेक्स क्या होता है, हम नॉर्मली से क्या बोलते हैं, BMI, ठीक है। बॉडी मास इंडेक्स, ठीक है। क्या बोलते हैं हम इसे, बॉडी मास इंडेक्स बोलते हैं। इसमें क्या होता है, हम पर्सन का, ठीक है, बॉडी मास इंडेक्स इज अ वैल्यू डिराइव फ्रॉम द मास एंड द हाइट ऑफ अ पर्सन। मीन्स पर्सन के वेट और हाइट से उसका BMI निकालते हैं, ठीक है। So the other name of body mass index is standard index, calorie index, citation index and Quetelet index. So the right answer of this is D, Quetelet index. It is also known as Quetelet index, okay. The other name of body mass index is Quetelet index. Nothing to understand in this question. Just you have to know that what is the other name of body mass index and what is body mass index, okay. And the unit of what is the unit of body mass index is kg per meter square, because we are taking the weight and the height in meter of the person. So the unit of the body mass index is kg per meter square, okay. Kg per meter square, okay. Move to the next question. Seventh question. Which action by the nurse is in change is essential when cleaning the area around the Jackson part wound drain? Okay, so the first option is cleaning from center outward in a circular motion, cleaning from peripheral towards center in circular motion, cleaning briskly around the site from left to right, and cleaning briskly around the site from right to left, okay. So firstly see the question, what the question is asking, that which action by the nurse in change is essential when the cleaning the area around the Jackson part wound drain. Okay, कोई भी wound हो, Jackson part wound drain, I'm gonna tell you later after this, but firstly you have to clear it in your mind that कोई भी wound हो, you have to clear it from center outward, center to outward in a circular motion. And the rationale of this principle is that the nerve should always move from the center outward in ever larger circle. ठीक है, from center to we have to move in circular motion in ever larger, means like as we moving outward we have to increase the circle around the wound. In circular motion we have to clean in a large circle. If we are moving outward, then it will be gone to the larger circle. And when cleaning around the wound drain, because what happens, the skin near the drain site is more contaminated than the site itself. ठीक है, जो wound hai, that side, the actual side of wound is not even that contaminated, but the area around that wound is more contaminated, the side itself, okay, than the side itself. That's why firstly we have to clean the central area, then the most contaminated area, which is outer side. Okay, the nurse should never remove the drain before cleaning the skin. Okay, if the person is having drain, okay, if the person is having drain fit in them, so what happens, firstly we have to clean the site. And in which way? From inward, from center to outwards in a circular motion, and then we have to remove the drain. ठीक है, सो कोई भी विंडो हमें यही प्रिंसिपल यूज करना है, और उसका रेशन मैंने आपको बताया। तो यहाँ पर को हमारे 4 ऑप्शंस दिए हुए हैं। ठीक है, तो फर्स्ट ऑप्शन है क्लीनिंग फ्रॉम सेंटर आउटवर्ड इन अ सर्कुलर मोशन इज द राइट आंसर। ओके, right answer. And about the Jackson part wound drain, ठीक है, so Jackson part wound drain is also known as JP drain or a bulb drain. ठीक है, इसे हम क्या कहते हैं, JP drain भी कहते हैं, bulb drain भी कहते हैं. It's a drainage device used to pull excess fluid from the body by constant suction. इसमें क्या होता है कि after any procedure, after operation, or in some conditions, what happens, there are we have to do drain at the site of wound or the operation side. ठीक है, is a drainage device. So what is this? This is a drainage device. ठीक है, what it will do, it will remove or pull out the excess fluid from the body by the constant suction. ठीक है, the device consists of a flexible plastic bulb. As we can see here, this is a flexible plastic bulb that connects to an internal plastic drainage tube. This is a drainage tube. Okay, then from here we have to apply pressure on that flexible plastic bulb, and what it will do, it will suck out the drain in this bulb. Okay, so this will help to remove the excess fluid from the body by constant suction. This is Jackson part drain, or we have seen here that Jackson part wound means there is a drain present in that wound. Okay, so we have to clean from center in outward in circular motion, and we have seen the Jackson part drain. And now move to the next question, which is 8th question. You came upon an unconscious victim with a palpable pulse. He does not appear to be breathing, and you are unable to deliver the first breath. What is the next step? First option is begin CPR. Okay, and B is abdominal thrust, and C is Heimlich maneuver, and D is repeat the head tilt and chin maneuver and attempt the breathe again. Okay, so this is a scenario based questions, and most of the time in question we used to get these type of question, this scenario question, in which we have to make a scenario in our mind that we are in that situation and what we can do, what we will do at that time or at this situation. Okay, so here we have a situation like, what is the situation? A unconscious victim is in front of us. Okay, and he has a palpable pulse, but he does not appear to be breathing. ठीक है, breathing नहीं हो रही है, and we are unable to deliver the first breath. We are not able to deliver the first breath on the patient or in the patient. ठीक है, so what we will do, we begin if we haven't given the breath to the person and after that we started CPR again, that will be no use of it. ठीक है, the CPR will be failed if we are going to do continuous CPR and we are not giving breathe to the patient. This will not work. ठीक है, and abdominal thrust is not can be used. Here the abdominal thrust cannot be used because there is no choking and something like that. Here's the unconscious victim which have palpable pulse but not breathing. So we can't do abdominal thrust on that patient. Okay, because he is unconscious and he has no means there is no like कुछ फंसा नहीं है उसके गले पे जिसे हम निकाल सके या फिर कुछ ऐसा नहीं हुआ है. ठीक है, अभी उसमें क्या हुआ है कि वो अनकॉन्शियस विक्टिम है और उसकी पाल्पेबल पल्स है. ठीक है, देन हेमलिच मैनुअल में क्या होता है, इसमें क्या होता है कि ये एक फर्स्ट एड प्रोसीजर होता है. इसमें क्या करते हैं, जो पर्सन का विंड पाइप है, ठीक है, उसके ऑब्स्ट्रक्शंस को स्ट्रॉन्ग प्रेशर अप्लाई करके एब्डोमिनल में, ठीक है, उससे हम निकाल सकते हैं. ठीक है, बट यहाँ पर को क्या है कि पर्सन हमारा palpable pulse तो है but he is not appearing as breathing. So the D option, repeat the head, tail and chin maneuver and attempt the breathe again. ठीक है, then हमें क्या करना है, अगर हम breathe करने में does not appear to be breathing and we are unable to deliver the first breath we are unable to give but second time we can give the breath. So हमें क्या करना है, repeat करना है head, tail and chin maneuver जो हमारे CPR के steps होते हैं. ठीक है, head टेल एंड चिन मैनुअर भी करना है हमें. ठीक है, उसके बाद हमें ब्रीदिंग अगेन से स्टार्ट करनी है. ठीक है, इसे हमें फिर से स्टार्ट करना है. तो इसका जो राइट आंसर होगा वो रिपीट द हेड टेल एंड चिन मैनुअर एंड अटेम्प्ट द ब्रीथ अगेन. ओके, then comes to the next question which is 9th question, which is MMR. ठीक है, so MMR is maternal mortality rate. The extent of MMR is maternal mortality rate. So here the question is not asking about the full form of MMR. Here the options are different. Like A option is maternal death per 10,000 live birth. Okay, and B is maternal death per 10,000 live birth. Okay, one second. Sorry, maternal birth. The first option is maternal death per 1 lakh live birth, and B is maternal death per 10,000 live birth, and C is maternal death per 1,000 live birth, and D is maternal death per 100 live birth. Okay, so the MMR is refers to the maternal death per lakh live birth. Okay, so here's the option A. Okay, option A is the right answer. Maternal death per 1 lakh live birth. Okay, and this is maternal mortality rate. Okay, then move to the next question. Is Kegel exercise that are useful for? Kegel exercise in one of the post-operative exercise or okay, the prevention of bleeding. Sorry, postnatal exercise. Kegel exercise are useful in postnatal exercise. So the A option is prevention of bleeding, B is strengthening of pelvic muscles, C is prevention of dysmenorrhea, and D none of the above. So the Kegel exercise is postnatal, one of the postnatal exercise, and we have studied about it. And the B option is strengthening the pelvic muscle. It is useful to strengthening the pelvic muscle. Kegel exercise. Okay, this is one of the exercise we can do in postnatal period. Okay, and इसमें क्या होता है कि इसमें A Kegel exercise is like pretending you have to urinate and then hold it. Okay, the Kegel exercise we have to do like we have to pretend like we are urinating and then holding it. Okay, we have to relax and tighten the muscle that control the urine flow. We have to do it like we have to relax it and then tighten it the muscles to control the urine flow. It is important to find the right muscles to tighten. Next time you have to urinate, start to go and then stop. Okay, first we have to do is pretending like we are urinating and then holding it, because we have to strengthen our pelvic muscle. Okay, then move to the next question. 11th question. First, giving CPR after ascertaining unresponsiveness, what should we have? One should. ठीक है, तो first one है आप लोगों को call for help. It is A. Okay, call for help. B, establish an airway. C, check the carotid pulse. Give D is give the chest compressions. Okay, so when we have started the CPR, the question is like for giving CPR after uncertaining responsiveness one should, means after we have done CPR, so that we have done the establish an airway, we have checked the carotid pulse, we have given the chest compressions, we have given the breathing, but after that the person is not responsive. Okay, there is no improvement we can see in the person, then what we have to do? So the right option is A, call for the help. Okay, and then move to the next question. 12th question. Which one of the following is recommended order for resuscitation? So resuscitation for CPR, the recommended order we have seen, A option is ABC, means airway, breathing and circulation. B is circulation, airway and breathing. C is circulation, breathing and airway. D is breathing, circulation and airway. So you have to know it. The right recommendation or the recommended order for the resuscitation is circulation, airway and breathing. Firstly, we have to maintain the circulation and then airway and then breathing. Okay, so CAB is a right option for this. Move to the next question. 13th question. Temporary loss of muscle tone and weakness precipitated by variety of emotional state is known as. Okay, A option is cataplexy, B is catharsis, and C is compulsion, and D is confabulation. Okay, so temporary loss of muscle tone, weakness precipitated by a variety of emotional state is known as, A option है इसका, cataplexy is known as cataplexy. It is a temporary loss of muscles. ठीक है, it is a temporary loss of muscles and weakness precipitated by variety of emotional state is known as cataplexy. ठीक है, or the catharsis is a process of expressing strong feelings for the मतलब catharsis means it is we can say that we are exposing our emotional state or is an emotional discharge, ठीक है, through which we can achieve a state of moral or spiritual renewal. And means catharsis is a Greek word which means cleansing. ठीक है, catharsis means cleansing. मतलब we can tell like sometimes it happens no that sometimes this happens that we can tell the emotional state of us or what we are feeling, then after that we feel good. Okay, so this is what the catharsis means, the cleansing of the emotional state or the cleansing of the feelings. Okay, then comes to what is compulsion. Compulsion is act of forcing somebody to do something or being forced to do something. Compulsion means we used to say that this is compulsory for everybody, means this is this is mandatory. Okay, compulsion matlab ki act of forcing somebody to do something which is and we are making force on somebody to do something. Okay, so this is the compulsion meaning. Okay, then comes to the what? Confabulation. ओके, तो कॉन्फ्लिब्यूशन का मतलब क्या होता है कि the symptoms of various memory disorders in which made up of stories fills in any gaps in memory. Confabulations मतलब कि ये जो होता है it is a symptoms of Alzheimer's or dementia, like the person is having a loss of memory and memory disorders. ठीक है, it will comes in the symptoms of memory disorder, means इसमें वो story made ups करेंगे और उसमें gaps होंगे, fills, मतलब कुछ भी, ठीक है, कुछ भी बोलना और कुछ भी story banana, ठीक है, this is all comes into the confabulation. And cataplexy is a temporary loss of muscle tone and weakness precipitated by the variety of emotional state is known as cataplexy. Then we move to the next question, 14. The parrot-like repetition of words spoken by other is known as echolalia, ठीक है, we have studied it in psychiatric, so it is echolalia, parrot-like repetition of word. Moves to the next question. In erection theory, adolescents develop a sense of erection theory is in pediatrics, and the what the erection theory say about the adolescents develop in erection theory, adolescents develop a sense of A is initiative, B is intellect, C is identity, and D is industry. So the right answer of this is identity. In erection theory, adolescents develop a sense of identity because we are talking about adults. Okay, so with this we have completed today's quiz or today's multiple choice questions. It is of 15 questions and we have seen from the first. Okay, so this is all for today. So friends, with this we have completed today's important questions for the AIIMS Nursing Officer exam. In the next video, we are going to continue some more MCQs and we are going to see some important questions for the AIIMS exam, which includes all the subjects like psychiatric, pediatric, OBG and all other subjects. Okay, so this is all and thank you so much.